Thank you for watching. Without further ado, I want to introduce you to Mrs. Smith. She is unforgettable. She is 54 years old, with a past medical history of hypertension. Her vital signs from a few minutes ago showed a BP of 174/98, a heart rate of 121, and an oxygen saturation level of 98%. She only smokes when she drinks, describing herself as a social drinker. She appears to be quite thin with a red and puffy face. She has been cooped up in the hospital room for 24 hours, and her restlessness and agitation suggest that sitting still is not her thing. It's clear that she's the type who works hard and plays hard. The situation becomes intriguing when she nonchalantly reveals to her nurse, "Despite knowing it's impossible, I kept seeing a cat up on the ceiling. It's quite amusing to watch the cat making different facial expressions." The nurse is intrigued and curious to witness this amusing cat. Unfortunately for the nurse, there was no cat in the room. The nurse informed the doctor that Mrs. Smith was experiencing hallucinations. The doctor evaluated her and asked if she was feeling anxious. "Yes, I am anxious. Look at my hands shaking," she replied. Mrs. Smith suddenly got up and started pacing back and forth in the room, shouting, "I am also nauseous and sweaty." The doctor calmly asked Mrs. Smith to sit on the side of the bed to discuss her alcohol consumption habits. During the conversation, Mrs. Smith also shared her favorite recipe for vodka cocktails. She also said, "I drink at least 4 glasses of these bad boys daily, despite my husband suggesting it's too much." Here's what we currently know. Mrs. Smith appears agitated and anxious, with noticeable trembling in her hands. She has expressed feelings of perspiration and nausea. Her physical appearance is that of a slim with a red and puffy face. Additionally, she has reported visual hallucinations. Her blood pressure is elevated and her heart rate is fast. Most importantly, she admitted to consuming alcohol daily. These findings are most commonly seen with alcohol withdrawal. The doctor suspected the patient was experiencing alcohol withdrawal and ordered folic acid, thiamine, multivitamins, and a clinical institute withdrawal assessment for alcohol evaluation to assess the severity of alcohol withdrawal and treat it with Ativan. Why thiamine? Alcoholics often have a thiamine deficiency, which can lead to paralysis or weakness in the eye muscles, difficulty with gait, and confusion. It is also known as Wernicke's encephalopathy. I hope you enjoy Mrs. Smith. Please stay tuned for an upcoming video on Mr. Smith's progress. Thank you for watching.